The Malaysian state of Johor is rushing to vaccinate 80% of its population by October. Its chief minister says reducing the spread of COVID-19 and achieving herd immunity will be crucial in determining whether the border with Singapore can reopen. Afifa Arifin reports.
Ramping up vaccination efforts across the state is a top priority for Johor, the Malaysian state worst impacted by the border closure with neighbouring Singapore. Some 1.5 million Johoreans, about 50% of the population, have signed up for the vaccination, and nearly 300,000 of them have gotten at least their first dose. Vaccination centres under the national programme are functioning in full force, with 43 private clinics and 7 private hospitals joining in to boost rollout. With this increased capacity, Johor's Chief Minister Hasni Mohammad is confident herd immunity can be achieved in a matter of months.
Our health department, our infrastructure like the vaccine center, the number of medical frontliners, basing on that, we should be able to vaccinate more than 500,000 a month, targeting 2.3 million Johorean. That covers 80%. So we should be able to reach sometime in October, where everyone, or at least 80% of the population is being vaccinated.
A Johor scheme to help Malaysians working in Singapore register for the COVID-19 vaccine is also proving popular. Under this EMU Plan initiative, the state has requested for 100,000 additional doses of vaccines for economic frontliners. So far, more than 70% of applicants have qualified and will start receiving their vaccinations sometime in July. Mr. Hasni says they're likely to receive the Pfizer vaccine, which is also being administered in Singapore. This as Singapore and Malaysia continue to work towards recognizing each other's vaccine certificates to facilitate cross-border travel in the future.
What actually triggered the state to develop the EMU plan is the idea of having to open up our borders. There has to be a specific program or application that address the need by this economic frontliner for them to be able to put hope that they can be given priority in terms of vaccine. They were allowed to be first in line as far as should the border be open up.
What about discussions about when the borders can reopen, or even some of the travel schemes like RGL, even the daily commuting agreement between Johor federal side and also Singapore?
The ball is in our court now. We just have to make sure that more effort is put towards reducing the number of cases in Johor, and I believe once the number is reduced to acceptable level, I believe Singapore will consider our request. But until then, we just have to make sure that we get everybody vaccinated as soon as possible. Johor, which all this while is able to contribute substantially to the national GDP. So it's so important that the economic activity in Johor to resume back to its original, level.
Johor also plans to secure its own supply of vaccines and is currently in talks with pharmaceutical company Pharmaniaga. It's also exploring other avenues, which include sourcing from other companies and even from Singapore, as it looks to the reopening of borders with its closest neighbour to revive its economy. Afifa Arifin, CNA, Johor.